Thank you, Devin. When cared for properly, contact lenses can provide a comfortable and convenient way to work, play, and live for the 45 million people in the U.S. who wear them.
While contact lenses are usually a safe and effective form of vision correction, they are not entirely risk-free, especially if they're not cared for properly. And here to tell us the risks of contacts and how we can wear them safely is Nurse Christina Paris.
Hey,
thanks for...
Morning.
Absolutely. We can see you.
Yes.
I got lenses on this morning as well, so it's impressive.
Awesome. That's awesome. Hey, before we begin, it is Nurses Week this week, so I just have to stop and give a huge shout out to all of my colleagues. Nursing is actually one of the most trusted professions because we're awesome.
They are.
Yeah.
And you did a great job through the pandemic as well.
Absolutely.
Frontline workers, we appreciate all the hard work that you've done and all the other nurses as well.
Yes, thank you to everyone who's put in the hours, because definitely not an easy job. Someone's got to do it. No. So we definitely appreciate all the nurses and medical staff out there.
Thank you. Thank you. So, getting back to contact lenses and you wearing them.
Exactly. Let's keep my eyes healthy. So, are contact lenses safe to use?
They are safe to use if worn properly. So,
that's a good start.
Yeah, so what are some of the tips maybe to make sure that you wear them safely?
Absolutely. So don't tell me if you do some of these bad things. I don't want to know. Dr. Gosnell, one of the optometrists from the VA, has urged me to have this conversation with you all because he sees the problems that can occur all the time when people are not wearing them properly. So let's get into the list here. So the first thing is you don't want to sleep in your contact lenses. If you sleep in them, you actually have an 8 times greater risk of an eye infection.
Oh, wow.
Like everything else, you want to make sure you wash your hands. You want to keep your hands clean and keep bacteria from getting on those contact lenses. Make sure that you're drying your hands too. Don't just rinse your hands and then while wet, grab your contacts. Make sure that you keep your contacts away from all water. Water can introduce bacteria, you know, sometimes, especially here, you know, if we have well water, if you have waters that just aren't quite clean, especially in the Northwoods. Make sure you don't rub your eyes, because that can, you know, introduce dirt and grime and kind of push it on in there. Never use water or saliva when cleaning. Our mouths are some of the dirtiest spots on our bodies. So you want to make sure you don't use saliva because you can have bacteria.
That seems like a horrible, why would you use saliva?
I can't lick your finger and then put it in your eye.
You would be surprised. Many people years ago used to, they would put their contact lens in their mouth to clean it.
It's not an envelope, people.
No. Don't top off or reuse solution. So in your container, make sure that you actually dump your container, and the next thing is to clean your case. So at least once, you want to clean your case all the time and then store it upside down so it dries. Replace your contact lenses whenever they're the manufacturer direction. So some are once every 3 months, some of them are daily, some of them, you know, depending on the type of contact lens. Make sure you're talking to your provider and know what type you have and how frequently to change them and do it appropriately. As we said, rubbing can scratch your eyes and damage your cornea, so you don't want to do that. Avoid showering with contact lenses. Again, you can get any kind of water, they're permeable. You don't want to get that bacteria in there. Itching your eyes, that's the same as rubbing. Just be really careful. If you have an allergy, take your contacts out, like clean them off, you know, especially right now when we've got the pollen flying in the air. It can really cause issues. With makeup can leave a film, so be really careful. Use caution if you're wearing makeup so that you know, most of us who wear makeup, our eyes will just flush it out normally, but if you have contact lens, it can sit under there. Again, when swimming, especially in lakes, you know, they're not antibacterial lakes around here, so you want to be careful. You don't want to get any algae or any bacteria under there and trap that can cause some permanent damage. And then be careful with sunscreen. Again, most of us, if we get sunscreen in our eyes, we can kind of flush it out normally. but if you wear contact lenses, it can kind of get stuck underneath the contact lens, and it can actually ruin your contact lens.
So for people swimming then with contact lenses, take them out before swimming?
Take them out before swimming.
Even if you wear goggles?
I would recommend anytime you have questions, call your eye doctor, call your optometrist. We have some great ones up here in the Northwoods.
And how often should people be seeing their eye doctor?
So you do want to see your eye doctor at least yearly. Now, I know before I started wearing glasses, it was every 2 years, but you know, and that's having healthy eyes. But you want to go in. They can do checks to make sure that you don't have any problems, not just with it's not just to check for your vision. You want to check for glaucoma, you want to check your pressures, you want to make sure that there's no damage with your optic nerve. And all of those things can be done through a routine eye exam. So don't just wait until you're older and like I can no longer see the paper and you're like me holding it way out. Go in routinely. It's really important for eye health.
Being proactive about your eye health.
Absolutely, because medications can make changes with your eye health.
Well, fantastic.
Yes, well, thank you so much for coming in and kind of telling us how we can be safe with our contacts.
You're welcome.
Exactly, and appreciate your nurses this week. Nursing Week.
Right.
Yes, absolutely. And we will have more after the break.